Hello everyone and welcome to the Star Health Insurance YouTube channel. I'm Dr. Shylesh M.P, a consultant neurosurgeon. I come across so many questions about brain that people think that they know the answers to but actually don't. Why do some headaches feel like they never go? Can stress really shrink your brain? So let's bust some of the myths and uncover the real facts about the most misunderstood organ in our body, our brain. Yes, in many cases, we as neurosurgeons perform a craniotomy or cracking open the skull, a procedure where we temporarily remove a section of skull to access the brain. This approach is used for various conditions, may it be brain tumors, aneurysms, traumatic brain injuries, or treatment of epilepsy or the epilepsy surgery. However, not all brain surgeries require opening up the skull. Depending on the condition and the location within the brain, we as neurosurgeons may use less invasive techniques such as the endoscopic surgery, where we insert a camera within a thin tube through a small opening, or natural pathways like the nose, where we perform the endoscopic transnasal surgery. There are other modalities like the stereotactic surgery, a minimally invasive method using imaging technology to guide small tools or lasers to the precise areas of the brain. This is called a stereotactic surgery. We have other modalities like the focused ultrasound therapy or the radiosurgery. Techniques like gamma knife uses beams of radiation or sound waves to target the brain lesions without any incision. The choice of the procedure depends on the patient's condition and the available technology. Not always, but for certain types of brain surgeries, patients are kept awake during the procedure. This technique is called as the awake craniotomy. Awake brain surgery is the other name for it, and it is used in cases where the surgeon needs to monitor or preserve critical brain functions like the speech, movements, or the sensation. So, would you be comfortable if you're awake, or why would you be awake? The brain itself does not feel the pain, so the patients can remain conscious during the surgery. Local anesthesia is used to numb the scalp, and the patients are closely monitored. Being awake allows the surgeon to identify and avoid damaging vital areas of the brain, test functions like speech, monitoring skills, or vision in real time. Ensure the best possible outcome for surgery near critical areas is the whole purpose of awake craniotomy. So it's a great question. While the brain itself doesn't have pain receptors, the surrounding structures and the tissues do. Headaches and migraines occur because of these pain-sensitive areas being triggered. What are the pain-sensitive structures around the brain? One is the blood vessels. The arteries, the veins, and their walls become inflamed or dilated, which can trigger pain. This is a major factor, and it is one of the pathophysiological mechanisms how migraines occur. The other structure is the meninges, which is nothing but the protective layer covering the brain, can become irritated. These meninges are richly supplied by nerves. Cranial nerves. Certain nerves in the head and face, like the trigeminal nerve, carry sensations from your face, mouth, nose, etc., are exquisitely pain-sensitive structures and play a significant role in transmitting pain signals. The muscles of the scalp, neck, and the face can become tense or inflamed, contributing to the so-called tension headaches. So secondly, why do migraines happen? Migraines are thought to involve a combination of nerve overactivation, especially the trigeminal nerve, which can release chemicals that irritate the blood vessels and the surrounding tissues. Abnormal dilatation or constriction of the blood vessels also do contribute for migraine. There is an overall change in the chemistry of the brain which causes imbalance. Alterations in neurotransmitters like serotonin can amplify the pain pathways. So nerve regeneration is a complex process that varies depending on whether the nerve is part of the central nervous system, that is our brain or the spinal cord, or in the peripheral nervous system, that is in your arms, trunk, or legs. There are something called as axons and myelin. Axons are the wires which conduct the electrical impulse. The insulation is provided by a lipid structure known as the myelin. Regeneration happens differently in the peripheral nervous system compared to the central nervous system. Peripheral nervous system has got a limited capacity to regenerate. But in case of the central nervous system, the capacity to regenerate is much lower. What happens after a nerve is injured is that it degenerates. It is eaten up by the immune cells, so-called macrophages. They clear away the debris, and again an extra neural tube is formed through which the axons regenerate to the target organ. So this is how a nerve regeneration happens. Pain tolerance varies widely among people due to a combination of various factors such as biological factors, psychological factors, and social factors. So let us discuss how these factors affect the variable pain sensitivities in individuals differently. Let's begin with the biological factor. Genetics do play a role. For example, there is a gene referred to as the COMT gene, which affects how pain signals are processed in the brain. Differences in the opioid receptor genes affect how the body responds to pain relieving chemicals such as endorphins. Endorphins are nothing but opioids, which are pain relieving factors which are produced within the body. There could be different nervous system sensitivity in different individuals. Some people are more sensitive, meaning their pain signals are amplified. Hormonal factors like the estrogen, testosterone can influence pain perceptions. That is why it is generally stated that women have lesser degree of tolerance to pain when compared to men. Endorphin levels. As I told you earlier, endorphins are opioids which are released within the body, which are pain relieving factors. When more endorphins are released, they experience less pain. This happens in people who practice yoga, yogis, etc. There are certain psychological factors also. Past experiences of trauma, injury, chronic pain can shape how someone perceives new pain. Emotional states such as anxiety, stress, and depression often lower the pain tolerance. Positive emotions increase the tolerance to pain. People who focus on or exaggerate the threat of pain may feel it more intensely. There are certain social and cultural factors as well. Different cultures have different varying attitudes towards expressing or enduring pain. For example, some cultures encourage stoicism, leading to people report or exhibit less pain. Others may normalize vocalizing pain, making individuals more open about their discomfort. Childhood experiences and role models shape how people perceive and respond to pain. Support systems such as strong social networks can make pain feel more manageable, increasing tolerance. There are certain pain modulation mechanisms, which we call it as the placebo or the nocebo effect. Belief in a treatment or expectation of pain relief can alter pain perception. Conversely, expecting pain to worsen can intensify it. In conditions such as fibromyalgia, the nervous system becomes hypersensitive, reducing the tolerance to pain. Local anesthesia works by temporarily blocking the transmission of nerve signals in a specific area of the body. That's why it's called local anesthesia. It prevents the brain from perceiving pain. So what is the mechanism of action? Nerve signal transmission happens through the so-called sodium ions. These impulses are carried by the sodium ions moving through the specialized channels in the nerve cell membranes. They are called as the voltage-gated sodium channels. The local anesthetics act by blocking these sodium channels. So lidocaine and bupivacaine are few examples of these local anesthesia. This action prevents the nerve from generating and transmitting electrical signals. The result, local part of the area or a small portion of the area of the body becomes pain-free or numb to pain. This effect is confined to the area where the anesthetic is applied, leaving the patient fully conscious. So what exactly is a concussion? It is a type of mild traumatic brain injury caused by a sudden impact or jolt to your head or body that causes the brain to temporarily move rapidly within the skull. This movement can disrupt the normal brain function, leading to a range of physical, cognitive, and emotional symptoms. So what are the immediate effects on the brain? There is sudden movement of the brain, which causes a shear stress between the soft brain and the hard skull surface. This can lead to micro tears in the brain tissue and disrupt the connections between the neurons or the nerve cells. It could cause chemical imbalance, trigger release of neurotransmitters such as glutamate, which overexcite the neurons, overexcitation drains the brain tissue of its energy and increases the demand of blood flow, but in reality, the reduced blood flow will further limit the oxygen and nutrients reaching up the neurons. So it causes various short-term effects such as confusion, memory, difficulty concentrating, headache, dizziness, nausea, sensitivity to light or sound. It could trouble your sleep. There are certain long-term consequences because of a concussion. We call it as the punch-drunk syndrome or the dementia pugilistica. Because of repeated injuries or impacts to your brain, your memory may come down, difficulty in concentration, a chronic fatigue-like syndrome can happen because of repeated episodes of concussion. There are certain medications which can improve your focus and alertness and concentration. As we all know, the regular coffee which we drink has caffeine in it. It is a stimulant. We have drugs such as amphetamine, which is available as modafinil, which can improve your alertness and performance. Drugs like ginkgo biloba are brain protective drugs. The traditional Ayurvedic medicine, that is the Brahmi, has got various benefits by taking it regularly. Omega-3 fatty acid is an important brain food. The so-called DHAs improve the brain function by leaps and bounds. A growing child requires DHA in high doses. These are available in fatty fish like salmon, sardines. Flaxseed is a rich source. Walnuts and other supplements have rich omega-3 fatty acid, which act as important brain food. Another regularly asked question: CT scans means radiation exposure. They use powerful beams known as the X-ray. Repeated exposure over time can increase the risk of cancer, especially in sensitive populations such as the children and other individuals. Also in pregnancy, it is said that CT scan can be harmful even for the child. A single CT scan delivers more radiation than a standard X-ray. It is equivalent to more than 100 X-rays. So regular, unnecessary CT scans should be avoided. While as MRI, there is no radiation involved. It uses powerful magnetic fields and radio waves, so they don't involve ionizing radiation such as X-ray. This makes them safer in terms of radiation exposure. But however, some kinds of MRI require contrast agents such as gadolinium, which can cause allergic reactions. In very rare cases can harm our kidneys too. So that's all for the video. Thank you for watching. Do hit the like button if you like the content. Share it with your friends and don't forget to subscribe to the Star Health Insurance YouTube channel for more such content.